Hello everyone, my name is Diana and today I'm going to be going over India's healthcare system. This is a little bit of overview what we're going to be covering today. Coverage, quality, cost, choice, facts about their healthcare system. And let's first start with their coverage and what does healthcare means to India. So in India's healthcare sector has been shaped by its federal structure and the federal state division of responsibilities and financing. The draft National Health Policy prepared in 2015 proposed that health be made a fundamental right and views government's role as critical. The central government is responsible for medical education, quality control in drug manufacturing, national disease control, and family planning programs. It also sets national health policy, including for the regulatory framework, and supports the state. There's two type of coverage in India. The first one is the public finance health insurance, which means that all citizens under the tax finance public system should be able to get free healthcare. And the most common used one is the private health insurance. So the majority of the private expenditures are out-of-pocket payments made mainly at the point of service. So what this means is that even though they have free healthcare, they still are struggling, to get the care they need and the treatments. So sometimes people that will actually rather, well, those that they can afford, that will actually rather to go to the private health insurance than actually through the whole public system, which will take sometimes, longer waiting time. And like I said, there's shortage of prescriptions. So that means that they're not all getting the treatment that they need. Now, as far with public finance health insurance, they're still supposed to be getting the preventative and primary care, diagnostic services, outpatient and inpatient care or hospital care. Now, one fun fact that I found online, it was that basically in 2013 through 2014, the total health expenditures was actually 4.2% of GDP. Government expenditures was 1.1% of GDP, which is lower than the average for low income countries. Household out of pocket health spending was 69% of the total health expenditures, making this a major component of the financing system. Under the National Health Mission, this free care in public hospital was extended to certain services. For example, maternity, newborn, and infant care and disease control programs. Now, I'm not sure if you guys know this, but in India, infant mortality is one of the huge health disparity. So they're trying to get to work, where they can actually lower their rate on this. Continuing with the problems. Some common problems they have is neglect of rural population, social inequality, shortage of medical personnel. So basically with the medical personnel, much of the problem is manpower. So there are about 750,000 doctors in India, which amounts to only one for every 1,425 people. And not only that, but many doctors will avoid rural service, leaving an even greater void in the places that need it the most. So basically, they're not willing, to work in the rural areas. So this is still a problem. Continuing with medical research, expensive healthcare system, still part of it. India continues to struggle with providing basic medical care for its citizens. After 2 decades of strong economic growth, Life expectancy in India falls short of most developed and developing nations. The infant mortality rate is 3 times higher than China's and 7 times higher than the United States. And this is a little bit of a chart, which basically, it states the top 10 causes of death between the ages of 30 to 69. I do apologize, it kind of cut off on the side. I tried to fix it, but I don't know why it wouldn't work. But as you guys can see, it all comes from, chronic respiratory diseases, cardiovascular disease, high pressure, diabetes, asthma, cancer, infectious and parasite diseases, of course. And some of the interesting facts that I found about their healthcare is that in 2015, life expectancy at birth was 68 years in India, which breaks down to 66 years for men and 69 years for women. India is the third largest exporter of pharmaceutical products in terms of volume. 80% of the market is composed of generic low-cost drugs, which seems to be the major driver of this industry. Also in 2015, the life expectancy, like I said, it was 68. I already went over that one. And that's pretty much it. I hope you guys don't have any questions regarding my PowerPoint. Apologize, my voice is a little bit scratchy, but I had a long day. But I hope everyone have a great night. Thank you.